it's now time for us to take a look at news stories making headlines around the globe today. Now, the Nigeria Center for Disease Control, the NCDC, have announced a death and 14 new COVID-19 cases in the country. The agency broke the news via its Twitter handle last night on Thursday night. Now, of the new figure, Lagos has recorded 13 cases, while Delta State has recorded 1. The 7 persons discharged in Lagos earlier on Thursday also reflected in the NCDC's new figure, which now has a total of 51 discharged patients. That's the brilliant or positive news, shall we say. However, the agency did not give details of the deceased in its tweet on Thursday night, and Nigeria has currently now confirmed 288 cases. So, unfortunately, we've had one more death from COVID-19 in the country. Rest in peace. The agency, the NCDC, have come out, and now we have 288 as our total tally. So the number is increasing as expected. Doctor, what is your take on this?
Well, I think we continue to see the numbers increasing. And the thing is, of course, apart from the official tally, it is possible that there are still so many cases out there that are not known. And, you know, I continue to argue that there should be greater synergy between private hospitals and the NCDC and the Federal Ministry of Health so that certain hidden cases can become part of the tally. What we were told is the figure as at 9 p.m. yesterday by NCDC is 288. But I've also seen some reports saying that there is a missing case of two from Ogun State, which may well bring the exact number to maybe about 290. But what we know, of course, is that the numbers are likely to continue. But so far, government's containment measures seem to be working. What I, however, find worrisome about the situation with COVID-19 in Nigeria is the attempt by certain states to relax the lockdown or to lift the curfew. In some of the states, well, Abia, for example, has, relaxed the curfew. The excuse is to be able to allow people to be able to stock up on food and also to be able to celebrate Easter. Ondo State has also tried to relax the curfew. I think Ebonyi, Katsina, Kaduna, Ekiti, many of these states, Niger State, at least about 3 or 4 of these states have no cases yet. But even then, that should not be an excuse to relax the lockdown in such a way that while we're trying to contain and isolate people and enforce social distancing, we now relax the curfew and allow free movement in such a way that, will further complicate the situation. And I think that in many of the cases, religious sentiment is the consideration. In Ondo State, for example, the Christian Association of Nigeria was said to have appealed to the governor to allow Easter celebration. And I think in that state, people are allowed to go to church on Good Friday and also on Sunday, although with the caveat that social distancing should be observed. It may be very difficult to enforce. If we're going to lock down, let us lock down. Religion should not, for any reason, become an obstacle. In Katsina State, for example, the governor has now allowed Friday Jumat prayers. Now, how do you ensure social distancing at Jumat prayers? That will involve a lot of people. In Kaduna State has relaxed curfew for 2 days of the week, Tuesday and Wednesday. So I don't know whether these are good steps to be taken. The second thing to note is that, the original 14 days imposed on Ogun State, Lagos State, and the Federal Capital Territory by the president when he addressed the nation on March 29. That ends effectively today. And the Presidential Task Force on COVID-19, when that team visited Lagos on Tuesday, the leader of that team, Boss Mustafa, said they were putting a report together and they were going to brief the president today. And after the briefing and inputs from the various states, the federal government will consider whether to extend the lockdown or not. So we're hoping that by the end of today, the federal government will make further clarifications as to whether the lockdown continues or not. But what I would like to see, perhaps, is an extension, not just an extension of the lockdown, but the extension of the lockdown at the federal level beyond Lagos, Ogun, and Federal Capital Territory to some other states, particularly Osun State, which has up to about 20 cases, and some of those, other vulnerable states. The third thing that we have seen is that there is a problem with food supply chain. And perhaps this is an indication that, look, we're more dependent on each other in this country than we usually think. Because, food supply vehicles from the north cannot easily access the south.
Yeah.
We're beginning to see the indication in the markets. Prices are beginning to go up. 50 kg of foreign parboiled rice has jumped from 22,000 to 27,000, and it's the same for other products, tomatoes and other products. If you've gone to the markets, even goat head, which I like very much, the cost has also gone up. The last time I tried to buy a piece of goat head.
Now you can't have your goat head.
So government has to worry about food supplies.
Absolutely.
And how that can be done, because as at the end of February, inflation was 12.20%. Now, by the time we get the report from National Bureau of Statistics for March, end of March, inflation figure, you can be sure it will have gone much higher.
Certainly, Doctor. I mean, you've raised some very valid points here and some very scary things that we're actually dealing with here. I mean, the fact that we are putting religion before a pandemic off the basis that it is Easter, I don't think it's justifiable in any way. I think there are certain things that we have to accept that sometimes we don't want to. We have to accept that this year maybe we cannot celebrate Easter in the way we would normally. And I don't necessarily think that giving leeway is doing anything but creating an opportunity for hotbeds all over the country. And it's such a shame that we are seeing how vulnerable really our leadership is when it comes to religion. And if we really and truly continue to let religion defy basic guidelines, basic policy that is there to protect us, to keep us alive, then one day, unfortunately, and I really don't want to say this, but it's going to kill us all. We cannot continue this way.
Well, by the way, it's like correction. The president and the presidential task force will meet today, but the lockdown that was announced on March 29. It ends effectively, I think, on Sunday. Yeah. Because it started on Monday, 11 p.m. on Monday. Yeah. So it will end on Sunday. But it's important that by today, Nigerians should have clarity about whether it will be extended beyond those 3 areas, and whether or not, it will be extended for a much longer period.
And I think we also need more clarity from the presidential task force with regards to exactly how the lockdown is going to work, because a lockdown is a lockdown, and we've been through this on the show severally this week, and you cannot necessarily say you're going to put or enforce a lockdown, yet have markets open and supermarkets open for such a long period of time every day, to the point where our newspaper reports are filled with gridlock traffic all across the cities. I don't necessarily think that's a strategy that has proven to work, so there's a lot of reviewing to do. Now, with a steady rise in the number of COVID-19 cases across Nigeria, Lagos State government on Thursday unfolded plans to begin a house-to-house search to identify those that are suspected of being infected with coronavirus. Now, the statement, or the State Ministry of Health, said in a statement that the exercise, tagged Community Active Case Search, in quote, is going to be phased and will last for 2 weeks in the first lap, and is going to cover all the 20 local government areas in Lagos State. Now, according to the Commissioner for Health, Professor Akin Abayomi, the officials carrying out the exercise can be identified with the COVID-19 outbreak response tags and a letter from the local government as well. Lagos now has 158 of the 288 confirmed cases in the country, so as we can tell with the epicenter. Now, meanwhile, NAFDAC have granted conditional emergency use of antibody and antigen test kits on COVID-19 patients in Nigeria. So a house-to-house search is beginning across Lagos, covering all 20 local government areas as a way of trying to spot, I guess, more people that may have or be suspected of having coronavirus. Doctor, what's your take?
It's a confirmation that the Lagos State authorities have seen that we're facing a case of community spread. Yeah. But a house-to-house testing process may be very difficult because people are likely to be skeptical, particularly for security reasons. Anybody can go and do a tag and knock on your gate and say that he wants to come and, check whether you've been coughing.